Fibromyalgia is a functional somatic syndrome. It affects about 2 to 8% of the population. Females are affected more common than males. It is important to note that fibromyalgia may not be diagnosed in up to 75% of affected people. Fibromyalgia presents with a chronic widespread pain along with fatigue, sleep disturbance, and increased pain in response to tactile pressure. Other symptoms which can occur include paresthesias, muscle spasms, weakness in the limbs, nerve pain, palpitations, and even functional bowel disturbances. Many patients of fibromyalgia also have cognitive problems, characterized by impaired concentration, problems with short and long-term memory. Fibromyalgia is frequently associated with depression, anxiety, and post-traumatic stress disorder, while some patients of fibromyalgia also report restless leg syndrome and sensitivity to noise, lights, and even temperature. Fibromyalgia is considered on the presence of chronic widespread pain, but pain may also be localized in areas such as the shoulders, neck, low back, hips, or other areas. Actually, patients with fibromyalgia have a lower threshold for pain because of increased reactivity of pain-sensitive nerve cells in the spinal cord or brain. There is evidence that the pain in fibromyalgia result primarily from pain processing pathways functioning abnormally. Moreover, some neurochemical abnormalities that occur in fibromyalgia also regulate mood, sleep, and energy, thus explaining why mood, sleep, and fatigue problems are commonly comorbid with fibromyalgia. The cause of fibromyalgia is unknown, however, it is believed to involve a combination of genetic and environmental factors. Environmental factors may include psychological stress, trauma, and certain infections. There is no specific diagnostic test. However, to diagnose fibromyalgia there should be a history of widespread pain lasting more than 3 months affecting all 4 quadrants of the body, both sides, and above and below the waist. Also, there should be tender points. There are 18 designated possible tender points, however, a patient with the disorder may feel pain in other areas as well. The differential diagnosis is made during the evaluation on the basis of history, physical examination, and investigations. Certain disorders may cause fibromyalgia-like symptoms, such as systemic lupus erythematosus, hypothyroidism, ankylosing spondylitis, polymyalgia rheumatica, rheumatoid arthritis, hepatitis C, peripheral neuropathies, multiple sclerosis. The treatment of fibromyalgia may be difficult. It is recommended that patients should have enough sleep, exercise regularly, and should take healthy diet. In fibromyalgia, pain rarely responds to NSAIDs and steroids because there is no inflammation. Low-dose tricyclic antidepressants like amitriptyline at a dose of 10 to 20 mg at night is the treatment of choice. The medications like duloxetine, milnacipran, or pregabalin may be used in fibromyalgia. Exercise programs are also beneficial in fibromyalgia. Also, cognitive behavioral should be advised. Use of opioid pain medication is controversial in fibromyalgia. Like and subscribe our channel for next coming videos.